Hello, this is Dr. Wells with Wells Medicine. In this fifth video, we're going to look at maintenance spacing and how to continue building in between treatments and things to continue doing as you start building a life after ketamine treatments. So during your fifth infusion, again, we're going to be asking you to do the quick inventory of depressive symptoms. By this point, you should be starting to see some changes from the ketamine infusions in getting up in the morning. Things feel a little bit easier. By this point, we're hoping that you've adopted some of the habits of taking vitamins, getting out and exercising a little bit, spending time outdoors, doing some meditation or prayer. And then we're going to want to make sure that you're doing some amount of either cognitive behavioral therapy or some thought work like life coaching. And we're hoping at this point as well that you've kind of started looking at some things that can increase anxiety, like stimulant use or caffeine use, and some of the things that can increase depression, like alcohol or benzodiazepines or marijuana, and kind of looking at how those can be limited in your life. Again, during your fifth infusion, we're going to be asking you about the vitamins, the exercise, the outdoor time, the meditation, and any therapy that you've picked up along the way. And we're going to be really emphasizing that there are some things that you can do to continue putting mental health on the front burner, to make sure that you're continuing to feel like this is a priority for you every day. So whether that's listening to podcasts, or whether it's reading books on depression or anxiety treatments, or whether it's working through your therapist or life coach, just having some goals and some plans to continue to feel like your mood is getting better and really building bricks in that wall of resilience between you and the depression and the anxiety. So again, at this point, we can always adjust your dose up or down. We'll be interested in any side effects you might be having from the supplements or from the ketamine itself. Which we can give you treatments for, whether it's the blood pressure medications or whether it's the nausea medications. And sometimes patients don't take quite the right supplements despite it being on our Amazon wish list and despite it being in our new patient packet. And if you're taking the wrong kind of magnesium, you'll definitely have side effects from it. So we'd love to hear about any of those so we can help with making sure it's the right kind of magnesium for you. Again, during all your treatments, you're getting magnesium and zinc and ketamine, trying to make sure that it's the right dose and a comfortable experience for you. And again, during this treatment, we'd like to encourage you to use the same music that you've been using and then to listen to that music at home so you have something comfortable and relaxing that really brings up some of those feelings and emotions for you. By this fifth infusion, we're hoping that you're starting to feel a little bit better and starting to feel like the ketamine infusions are improving your resilience, your flexibility, your ability to adopt some of these coping strategies. And so as you're moving into the maintenance phase, how often should you keep coming for ketamine infusions? We have all kinds of schedules available to patients. Really, it's based on your work schedule, your availability to come in, and how far between infusions your mood effects from the ketamine last. So at around the fifth or sixth infusion, very frequently patients will notice that their mood being undepressed or their decrease in anxiety lasts about 3 to 4 weeks between infusions. Sometimes if patients are taking a lot of medications like Lamictal, benzodiazepines, this can be as short as 1 to 2 weeks, even at this point. But for most patients, we can get around 3 to 5 weeks. So we strongly encourage patients to book an appointment around 3 weeks after their last infusion of the series. And this allows them to have an appointment at a time they prefer on the books, and things won't get booked up at the time that you would prefer to come in. And it allows you to have sort of a scaffolding in case your mood does start to decrease. You'll know that there's something in the schedule for you to kind of bolster your mood back up. So we really encourage around 3 weeks after the first one. Now, some patients kind of going through a lot of changes, even picking up habits like exercising, decreasing alcohol and benzodiazepines, those can be very stressful changes to patients as well. So we really encourage patients going through a lot or patients who noticed only on the third or fourth infusion the mood effects of ketamine to really come in maybe around 1 to 2 weeks. But usually we can get to around 3 weeks pretty quickly. So we'll start spacing, going from 1, 2, or 3 week spacing, depending on your schedule and our schedule, and what works best for the fade that you see after ketamine treatments. Once we're in that spacing, we do tend to increase even a little bit more, and we'd like to see that it sits somewhere around every 3 to 5 weeks. We find that that's usually when the mood effects of ketamine start to wane. That's when patients need reaffirmation of their coping strategies and exercise, and sometimes they start forgetting to take vitamins or getting outdoors or meditating or praying. So somewhere between 3 to 5 weeks is good spacing. I hope these videos are useful in preparation for coming in for ketamine treatments. And if they are, please let us know by liking, subscribing, leaving us some comments. Let us know what would be more useful for you to have information about. And I hope to see you in other videos.